Hello, my friends. How are you? And welcome to this thing of ours that we call the Financial Physician Radio Program, where we get together each and every Sunday, 12 noon Eastern Time, 9 a.m. on the West Coast, and we talk about money. We talk about markets. We talk about the economy. We talk about politics and how that affects our wallet. And, you know, people always say, Lou, why are you so political on your shows? I thought it was a financial show. Well, nothing affects our money more than what happens in Washington. From taxes to Medicare, Social Security, regulation of businesses. I mean, what happens in Washington affects us big time in our pocketbook. So let's talk about what's been the big subject this week, or it's been a big subject since Mitt Romney chose Paul Ryan to be his running mate, and that is Medicare. And this is really interesting to me, how the Medicare debate really has turned. And, you know, when I first heard that Paul Ryan was being picked to be Romney's running mate, I was really concerned. And I mentioned that last week on this program. I was concerned. And after watching this past week, watching how the Romney camp has framed the debate on Medicare and how Paul Ryan is able to communicate about it, I feel pretty good about it now. Now, the Democrats, they were gleeful when they found out that Paul Ryan was going to be Mitt Romney's running mate. And they said, okay, now we could hammer this guy with his Medicare changes. And nothing scares seniors more than talking about taking away an entitlement or changing an entitlement. It's been the third rail of politics for so long. And they felt that they had themselves a home run bat here, where he would be vilified for wanting to save Medicare through making some changes. But it seems now that the Obama camp is really on the offensive here and are running with this Medicare thing. They're not running away from it. They have become offensive. And I think very successfully. Romney and Ryan are out there saying to seniors that Obamacare is raiding Medicare. Because part of the healthcare law is a cut of over $700 billion to Medicare. And it's amazing that the Republicans haven't run with this earlier. Because the only one really cutting Medicare is Obama. The Paul Ryan plan does not cut Medicare at all. It changes it. It tries to make it more efficient. It tries to give people more choices. But it doesn't cut it. The Obama administration says the cuts are not to benefits. It will not affect beneficiaries of Medicare. What it's going to really do is going to just lower the amount they pay to doctors and providers. And of course, it always sounds nice. We're going to cut fraud out of the system and so forth and so on. They've never been able to do it up to this point. So what makes them believe they're going to be able to do it in a meaningful way now? But how can you tell a senior that, yeah, we're going to pay the doctors less and less and less, but it's not going to affect you at all? How many doctors are going to leave the profession? Or just not take on Medicare beneficiaries? And if they're not going to get paid, they're not going to take them. It's that simple. So it's a bit disingenuous that the Obama team is saying that this is not going to affect seniors. In Texas, which is one of the few states that track doctor dropouts, doctors that just leave the industry, the number of physicians accepting Medicare patients fell from 78% in 2000 to 58% in 2012 because of cuts in payments. And there's more cuts to come, according to Obamacare. So by punishing doctors with lower and many times below cost fees, that means there's going to be fewer doctors that are going to take Medicare patients. It's going to take longer to get an appointment. And may I say, this is rationing. This is the argument that's been made about rationing. And, you know, we know there's panels now that are going to make decisions whether or not you're going to get that hip replacement or that knee replacement operation based on your age and the cost effectiveness of that treatment. So when we're looking at Medicare, I mean, it is really Obamacare that people really need to be concerned about. And I think the Romney team has been very successful in framing the debate that way. As a matter of fact, recent polls, let's take Florida for instance. More seniors are backing the Ryan plan than Obamacare. They're more afraid of Obamacare. And, the Democrats came out and said that that this guarantees Florida for Obama. Doesn't look like it right now. It doesn't look like it. Now, of course, both sides are never 100% honest in the debate. And, the Obama came out and he said, he cited studies estimating that the Republican plan of using vouchers or premium payment from the government would force seniors to pay as much as $6,400 a year for their health care. An extra $6,400 a year. Now, where the study came from, I don't know. But you can throw any numbers out there you want. So what it is really, clearly, and I've studied this and I've listened to a lot about it, and again, if you're going to get your information from commercials, political commercials, you're going to be misled. By both sides. That's the nature of political campaigning. That's the nature of political commercials. And this is the way it is. If you're 55 or older, you're not affected at all. I'm 52. So I'm not in that crowd. So that means if you're currently on Medicare, nothing changes or will ever change for you. If you're 55 and you're planning on Medicare, at 65, 10 years from now, you'll have the opportunity to go into traditional Medicare without any problem. So now we're just talking about people who are 55 and under. So that takes away all the seniors out there. This is just, the Obama team's out there trying to scare you, which has always been their way. Scare you into thinking that Paul Ryan and Mitt Romney are going to take away your Medicare. It's a lie, but it doesn't matter. They said it will change Medicare as we know it. That's the phrase that they're all using. But maybe that's true. But maybe it's changing it for the better. You ever think of that? Or at least maybe so it'll still be there for us, the younger generation. And another thing, too, about this $716 billion cuts in Medicare. Think about it. We have 10,000 people a day turning 65 in this country as the baby boomers retire. And that's going to go on for 18 years. Think about that. 10,000 people a day are moving into Medicare. And they're going to cut $716 billion from the program? How are you going to do that? Well, they're going to do it two ways. They're going to not pay doctors and hospitals what they need to be profitable, scaring them away from taking care of Medicare patients. And they're going to give less services to older people. These death panels that they were called. That you will not be able to get an operation, you will not be able to get a service if the government bureaucrat somewhere in Washington thinks that it's not worth the money. So what happens if you're younger than 55, according to the Ryan plan? Well, according to the Ryan plan, if you're under 55, when you turn 65, you have the right to go into the traditional Medicare plan that's now available to everybody. So really, it would not change anything for anybody who don't want it changed. But some people may not want to go into the traditional Medicare plan. It has a lot of shortcomings. And let me tell you, 10 years from now, you're going to see that fewer and fewer doctors are going to take traditional Medicare. So what the government will give you is a voucher. They call it a voucher or a premium subsidy, whatever you want to call it. They're going to give you a certain amount of money, and that amount of money is going to grow based on GDP growth. And you're going to use that money to purchase whatever type of health insurance you want. Now, say you're healthy and your needs are such that you really don't need a very aggressive policy that covers everything, right? And you want to pay a higher copay and stuff like that. Well, it will cost less than the money they're going to give you. And you can pocket the difference. Or you can get a plan that's similar to Medicare, that voucher, that amount of money will pay in full for that insurance. Or better yet, and this is what I like, this is called freedom. For those who don't remember what freedom is in this country. is you can add money to the amount the government gives you and buy a Premier Cadillac plan. That's much better than Medicare. Now you have to buy, Medicare only covers 80% of costs. So many seniors go out and buy another health insurance policy called Medigap or supplemental insurance. There'll be no need for that at this point. The amount of the supplementary insurance would be basically how much more health care you really want to get covered. So this gives people choice. It gives people freedom. And according to Romney and Ryan, will help preserve Medicare for the next generation because there'll be cost savings because you'll have competition between insurance companies to keep those premiums low and keep the cost of the government down. So what we're basically doing here is we're switching from government-run 100% senior health care to more government/private senior health care. Which sounds good to me. It sounds good to me. Because I like to have the ability to buy a better insurance policy than Medicare if I could. And I could afford to add the money to what the government's going to give me. So the Medicare debate, you're going to hear it demagogued on both sides between now and Election Day. It's kind of backfired on the Democrats in the Obama camp who really relished this argument and debate. And now they're on the heels. Because the flashlight, the big spotlight has been shined on Obamacare, and they framed it exactly the way it needs to be framed to let seniors know that the only one cutting Medicare is Obama. It's the law. It's the absolute law on the books right now that Medicare is being cut $716 billion. It is the law of the land. And I tell you, the good thing about this is that, Romney's running now and saying the first thing we want to do is repeal Obamacare, which means we're going to repeal the $716 billion in cuts to Medicare. So a senior properly informed has to vote for the Ryan plan. And now, again, the Democrats now have really exposed this Medicare, Obamacare tie here. And Romney and Ryan have basically hit it out of the ballpark as far as shining the spotlight on this. And the Dems never thought that they would be on their heels on this subject. Now, I said last week, I thought the pick of Paul Ryan was risky. I said all we're going to hear about is Medicare every day as opposed to the economy. And so far, that has been a good thing for the ticket. And it's going to be interesting to see if the Obama team tries to get away from the Medicare subject and maybe try to refocus attention on Bain Capital, or Romney's a greedy rich guy that hates kids and dogs and old people. But again, I said maybe this pick of Paul Ryan was genius. Maybe I was wrong that it was going to be too polarizing, that we may lose Florida or whatnot. But it turns out maybe it is genius. So far, it's only been a week that we've had this debate out there. But it seems that the Romney camp is winning the debate on Medicare, which could mean the election itself. Very, very interesting turn of events.